Serving the health insurance needs of elders, or SHINE, is a statewide program that uses volunteers to help Floridians obtain unbiased information on Medicare, Medicaid, and long-term care options. Lisa Marie Rykoff with the Central Florida SHINE office is here to tell us more. And Lisa Marie, I don't think there's a more confusing subject than health insurance plans, things like Medicare and Advantage plans, and all of this. We're bombarded with all of these types of insurance, but SHINE is an excellent program. So tell us about SHINE.
Yeah, we're here as SHINE is to help you kind of walk through a lot of the complications. So we work in partnership with your local area agency on aging, which is Senior Resource Alliance, and the Department of Elder Affairs. So as part of the program, we want to make sure that folks are choosing their correct Medicare options.
Right, and speaking of options, what are some of those options? Just give us a list of those.
Oh, definitely. So folks typically call us when they're looking for Medicare assistance, but we can also help them sign up for different Medicaid assistance programs like a Medicaid savings plan, extra help with the low income subsidy. We'll also help with some of your long-term care planning needs. So if you're concerned about how to set those things up, we can help you with those as well.
And so that's kind of basically it, but tell us, how do you kind of directly help people?
So we have a team of volunteers. I have about 40 volunteers that work for us in the area. And what we do is we reach out to folks with any questions that they have. So typically what they do is they give us a call.
Okay.
And once they give us a call, we set up a time for them to speak with a counselor. We're going to go through any options that you have for healthcare.
And so folks can actually directly call and get an actual person to talk to.
Yes, they'll be speaking with me or they'll be speaking with another volunteer immediately.
Right, because I think that's kind of, concerning. Sometimes you've got these questions about, I'm signing up for Medicare or I want to change Medicare plans. Who do I go to? Where do I get some good unbiased information?
Yeah, it's very confusing. Right around when folks turn 64, they're going to start getting bombarded with a lot of those papers that are saying, hey, you should sign up for this plan or you should sign up for this plan. But what's important to us for our volunteers is that we're not specifically enrolling you in a specific plan. They're not paid. They're not compensated in any way. They're not there to be making money off of whichever plan you sign up for. They're there to provide you with a guide to the information that's available.
And I think that's what gives folks kind of that level of security of, oh, I'm not going to be talked into something that I don't need or it doesn't really apply to me. So you're telling us with the volunteers, they don't really work for any of the particular health insurance companies.
Absolutely not. In fact, as a volunteer, you're not allowed to have an active insurance license, period.
Really?
And we don't allow folks to recommend to specific insurance agents either. We want them speaking to the most unbiased person that they can.
Oh, see, that's terrific. Now, something you touched on, Medicaid, long-term programs. What about that infamous Part D prescription plan? Do you address and help folks through that? That's confusing.
Absolutely. So when Part D was introduced, there was lots of concerns with scams. There was lots of concerns with fraud and abuse. We make sure that we help folks navigate through that. We help them pick the best Part D plan for themselves. We also can help them find extra help and income from Medicaid to assist with those programs as well. So we'll make sure that folks exploit all their options.
Oh, absolutely. And, volunteers, we're really big on volunteers here.
Yeah.
And so I'm sure you're always looking for folks. So how would someone, go about really becoming a volunteer?
Absolutely. So if you go to floridashine.org, we have a great application on that site. You'll apply, it'll get sent to me, and you're going to hear from me within a few days. And we're just going to have a conversation about why you want to volunteer with SHINE. During the latter part of the year where things in open enrollment start kind of picking up, that's when you're going to be busier as a counselor. But we're looking for folks who are willing to commit 4 to 10 hours a month just calling other constituents and asking them what they need.
And need is the important word there. Folks need that great information. And Lisa Marie, thank you for sharing how some volunteers can help Floridians better understand their Medicare, Medicaid, and long-term care options. That's great information. Thank you.